ongoing conversations about this topic, you can sign up. We'll try and coordinate kind of an ongoing discussion with that group. So look for those sign-up sheets in the networking room. Come into this room if you're looking to connect with vendors. Give us feedback and enjoy the rest of the summit. Thanks, everyone. You can start talking again, sorry. Okay, everyone, it is about time to get started. Day 3, here we go. Buckle up. It's the last loop of the roller coaster. I really just wanted to say thank you to all of you that have come and attended so far. I know there are some of you that are going to be leaving before our concluding session. So thank you for coming. Thank you for participating. Thank you for sharing your insights. It's because of you that this event works. We are going to start now with our panel. So I'll invite the panelists to come on up on stage. We are very excited for this panel. It's a question that we get frequently of, I know how important the work is that we are doing. How can I convince other senior leaders in my organization to buy in? It costs money, it costs resources, it costs time. And so we have this great panel here who's going to be discussing this. Very excited to hear their insights. We will invite audience participation as well, so there will be some people, class employees with mics roaming once we open it up for questions. But without further ado, I'll turn it over to Dr. Maneker to run the panel.
Hi. I have to stand up. Sorry. I'm Amy Maneker. I'm a PhD doc by background. I've been a CMIO and I'm the CMIO of Tharge Collaborative. Some of you may know me as Yo Amy if you were in the definition session yesterday, so thank you, and that's fine as well. And we are thrilled to be here and thank our panelists for joining us, and thrilled to have all of you here. And this comes up, as Connor said, virtually every data review call or strategy call, when we talk about the opportunities, almost invariably someone says, but how do I get buy-in from senior leadership, AKA how do I get the resources and the support? And so we thought we'd talk about it and hear from 3 experienced individuals. So I'm going to quickly address the panel and then we'll get to chatting. So Dr. Ray Keller from UVM, who you may have heard of, they are well known for their sprints, is a ED doc and an informaticist, boarded in both. He's the CMIO at UVM Health and was previously the director of emergency medicine. Nikki Mayfield, now I need to use my cheat sheet, I can't remember everything, leads the clinical informatics and applications team at Valley View Hospital in Glenwood Springs, Colorado, and has her master's degree in clinical informatics and nursing. And we also have Dr. Mark Guy, who's a family physician who serves as the leader in informatics at Allegheny Health Network. And he is currently focusing on combining insights from their first-class survey and the rigorous EPIC refuel program. So with that, we will start with, we're going to start left to right, if that's okay. And Mark, what is a specific tactic you have taken that has worked for you to get buy-in from your leadership? You can share a specific example.
Just to open up the begging notion that was brought up yesterday is probably part of everything we're going to have. So that was tongue-in-cheek. You didn't laugh, so that's concerning to me. Yeah, I think there's a lot of free thought we're going to offer here this morning. There's no one tactic that works. I think being aware strategically of what executives are facing in a very tumultuous time and figuring out how you can communicate effectively into their incomplete understanding of what technology is so that they can get a vision for how the technology is needed to do the work that they see as part of the path forward is the job we've got to do. So it's for me, it's an informatics job, right? It's almost translating the technology thing to the executive suite, just like we have to do that for clinicians and operational leaders that we work with. So a lot of that is communication and understanding where folks are at, and understanding where the pain points are at, and finding the strategic moment that they're in. We had a great opportunity because we were coming into refuel to get the temperature of the water, the context that we were speaking of yesterday, and quantify that. I'm going to go along just a couple more phrases, and I promise I won't go on and on and on. On the way in was listening to Chris Kelly's conversation around training versus mentoring, training and working with health systems and understanding where providers get stuck at, and trying to understand how it is you can impact that culture with information and understanding how you motivate folks to move through change is important. So I think that's the same for the C-suite.
Thanks, Mark.
Yes, my
Nikki?
pleasure.
Yeah, I would agree. I think some of the biggest successes that I've had is having an ally team. So just really building a team of people who are behind you, starting from boots on the ground, providers and clinicians, and then really finding at least one ally on the executive team to bring you to the table to speak and get buy-in from that group. For me particularly, it was our CIO who I built a really good relationship with, who was able to get me at the table of the executive team and really understanding the strategic plan of the organization. So really aligning my roadmap and my action plan with where the organization was going. The executive team was really focusing on our ambulatory side with every provider seeing one more patient a day. And so really focusing our concept of sprints, onboarding and training efficiency and proficiency with the EHR in alignment with that strategic goal to get their buy-in, and then the data. So Class Arch Collaborative has been crucial in delivering this message to show the data of how this is impacting providers and clinicians across the organization, just to get them to buy in the first place, and then sharing that data across them to see how we're making an impact here to really tell that story of that deliverable of the work that we're doing.
Thanks. Ray?
Yeah, so I think I'm going to actually use our Sprint program as an example of a success, and once again recognize Rachel and Lauren and Allison, who did an incredible job out here with their presentation. But when this was being born, you know, it was also during a time when we were rolling out our Epic to the health network. And our network CEO was very involved in that process. We had regular meetings where we would, you know, talk about the project. And one of the things that he was concerned about was the 2019 Arch Collaborative survey that we had shared the results of, and that was our first survey. And he was very concerned that we're rolling this out, you know, and our providers were not happy. And so we talked, so we knew that that was important to him, and we had just completed a pilot that IT kind of funded internally of these Sprint programs, and we did the, you know, the pre and post measuring and had great success. So the point I'm making with this example is timing is part of it. And so he really knew that we had, he was asking a lot of questions. You know, we had implemented Thrive, doesn't seem to make a difference. We, you know, all the things we'd done, but he said, I see the data, which we provided him, that shows great success. This is the only thing I can see that's made a difference. I want to do this. And so we were one of the few places that got 2 extra FTEs in order to put together a full Sprint team and start doing it. So, you know, there are lots of principles in there. One is timing, one is data, and you got to think about what data you're giving, because if I'm giving the data to the CFO, he wants dollars. You know, so you have to think about what data you're using. And I have some other examples I think that'll come up later too, but for now, I want you to think about timing and data.
So on that note, I'm going to ask you all, but I'm going to share one first. What's your general advice? I think it was embedded in there, but what if you had 3 principles or 4 to share? My personal one is hook your caboose to the freight train. So align with some really big organizational goal. Sometimes you have to be a little creative. I didn't say that. And then glom onto that organizational goal, so that in my experience, my cost was like not even a rounding error to the huge organizational initiative. So that's my one general principle. These guys I'm going to ask, starting with Mark, for 3 or 4 just general principles, which you may have already embedded in your conversation, but don't feel free to repeat. We're good.
Sure. So I'll add to that trust, being trustworthy and being a person of integrity and delivering on your previous asks, and making sure that you're showcasing those deliverables that you have brought in before, so that as you come in to make an appeal to the executive leadership team, that the credibility that you bring and the data that you bring and the strategy that you're participating in, you add your integrity too. That's maybe goes without saying, but it's been really important principle for me.
I agree with that. I think the relationship building and trust with your allies and your team, and then making sure that you're communicating back, starting with easy wins, and then as you continue to get wins, you're just going to get more and more buy-in from the people that you need. So really being thoughtful in what you start with, to know that you're going to start with successes, continue to communicate those successes everywhere you can, so that people are hearing and talking about it. And then as you start asking for more, you're just kind of building on those blocks and kind of building your ally team with you as you go.
Yeah, and I think we're all going to be saying probably the same things, maybe with different words. But I talked about timing and I talked about data, the right data. But as I was thinking about this, I think the other principles that have been successful for me, and I will tell you, I've been at the University of Vermont for 30 years, so I've been there a long time. So the three things I think that you need to keep in mind is, and I'll use myself as an example, we're passionate about what we think is a solution to a problem. And you have to keep in mind that the person you're asking, they're likely wants to solve that problem too, but they're seeing it from a different angle and with different probably limitations. So, you have to realize that the what is going to be important. Like, what is it that you're trying to do? But there's another thing that I've learned since I started doing informatics from change management, and that's the why. So we always want to rush in with the why, with the what, but we need to remember the why. And I think if the person you're discussing this with leaves knowing not only what you asked for, but why, I think you're more likely to get it. This kind of ties into, I think, something that was said here, and then that's the relationship. I can say that most of my successes have been because of my relationships with people, and I've been there a long time, and it takes time. So no matter where you are in your career, I think you need to think about the relationships that you're forming, and that you need to put time into it. I think this remote work and COVID, especially in informatics, a lot of people aren't around, it makes it more challenging, but relationships are so key. As Mark said, I believe, talking about, they know you, they know that you're trying to do the right thing because they've seen that before, that I'm not out to do it for me, but I'm looking at the greater good. Those relationships are so important. And it's not just the relationship with the person you're speaking with. It's the relationship with the people who also have their ear. So, you need to think kind of strategically about it and think, who else can I get on my train? Who's going to be, meeting with this guy? Who can help me even more? And the last thing, so I'm an ED doc, okay? Does anybody know what hookah means?
I have to step in here. We on the panel here are waiting with bated breath
They
to
didn't know.
understand what hookah is. So if you do know, have at it, but we're waiting.
Nobody can shout it out. It has nothing to do with drugs, let me tell you that. But anyway,
That's what we guessed.
okay,
So.
Is that Canada that was thinking
Yeah,
that
it's
way?
Canada.
Yeah. I'm not surprised their smoke is blowing on me in Vermont. But anyway, so hookah means hang up, call again. And it's my kind of hang up, call again. It's persistence, right? I feel like being an ED doc, that's what I have to do. All these patients are coming to me, they're falling through the system, and I got to get them what they need. So hang up, call again, right? It's persistence. Let me just say, this does not work at home. When I do it at home, my wife says, "You've asked me that already. Are you hoping for a different answer?" And I said, "Probably." So, but anyway, so it really is persistence. And it's easy for me to be persistent because I feel like that's who I am. And one of my children is exactly like me. And, somebody asked me once, they said, "Boy, working in the emergency department must be really hard. Do the patients ever wear you out?" And I said, "Oh, you know how many patients have worn me out in 30 years? 0. Do you know how many I've worn out? thousands. So I was just like, so it's really easy for me to be persistent, and I have to watch because sometimes that's one of my faults. I'm too persistent. I don't know when to stop. So
I think my kids this would resonate with them. Hang up, call again. What I always say to them was, at least I'm consistent. So I like that one.
Amy, can I throw in, we didn't
Of
really
course.
speak about passion, and you can see some of that in Ray, but I think if we don't have our own passion for what we're doing here, you don't have a ghost chance, right, of convincing anyone else. So check
Really
yourself
good
first
point.
and figure out what is your passion and what are we trying to do. If you weren't inspired by the keynote address yesterday, think about switching out, because I think this notion that the folks in this room are really creating the context that the healthcare system is living in as it goes through the transition it is in should be enormously inspiring. It's inspiring to me. So check your passion quotient, and if it's not there, figure out what you need to do about that before you make your appeal.
My passion sometimes gets in the way. I also think there's a time where you feel so committed about something that it gets emotional.
Yeah.
That sometimes I have to.
yeah.
So
That's
on
unlimited.
that note, let's talk about lessons learned. So if you could, and are you willing to share any missteps? So what about if you didn't get the initial easy wins? I love initial easy wins, but it doesn't always work that way. Or wherever you're like, hey, I could have done that differently, and you had to hang up and call again.
I'll start. So I think one of my recurrent missteps is not showcasing, is not quietly going about the good work that you're doing and not bringing that to the attention of not just one leader, but the group, to know that you're making progress. And I think I maybe denigrated that in the past as kind of being a bit of a bragger, but I think that showcasing good work from your teams is really, really important. The new leader that we have in our organization has really shown me how to do that well and to do that genuinely with sincerity. So I think that's been a hole for me that I'm learning a lot about myself in.
So it calls to mind, there's actually a recent case study. One of my classmates is going to redirect me if I'm wrong. I think it was Cottage Health, where they almost like announce each week what they've done. And I think we often have that we forget to toot our own horn, even in subtle ways. And so if anyone wants to look up that case study, that was a subtle, constant, like, this is what we did this week. Nikki.
I agree. I think anywhere in healthcare, especially in leadership, you are always kind of trying and failing and trying and failing. And the first day with the mountain bike racing analogy really stuck with me, and the passion. I think that's what we do. We all
Get
have
through the mud.
we all have something that we are passionate about that is really important to us, and we try a lot of different modalities and ways. Things that I have done in the past that failed were really siloed approaches, just trying to make movement and really coming to the realization that you won't be successful unless it's an organizational collaboration and that kind of culture shift. And that is really challenging. But again, it comes back to building the relationships and taking the time and kind of starting with those smaller successes. And if you try to approach things in a silo approach, it just is going to fail.
Yeah, so a couple things come to mind, and the one is I do have a lot of passion, and sometimes that drives me to look at decisions as win-lose. Like, did I win? That's not right, because you don't want to be speaking to someone, and talking to them where you're looking at it as, am I going to win or am I going to lose? Because you want to look for common ground. You want to look for maybe a different path forward. If you're looking at it for win-lose, you're going to be stuck on your what. And there may be another path forward, or there may be a little win you can get out of it. And I think that's one of my weaknesses, is that I do tend to look at that as more of a win-lose, and I have to really kind of talk to myself and say, how how can you change your approach, the way you're thinking about this before you go in there and talk, because you don't want to come across that way. I'll tell you a time that we didn't get what we asked for, and we're still struggling with it, and I assume Justine, our fantastic nurse informaticist, is here somewhere, but I've been fortunate over the years. One of my big goals was to build this physician informatics team, and I was very careful about who could be on the team because I really wanted to present a certain image, and I really wanted common ground. Together we decided we're all going to be physician builders, and what really we're going to be doing. And it's my biggest success in informatics, and I feel like it's time for me to go because these people don't need me. I follow them now. So we tried to do that for nursing. And I'll never forget that presentation to the senior leaders, and our nurse leader, our CNIO equivalent, gave the presentation, and it fell flat from everyone. And the reason was we were coming out of COVID, the government funding had stopped, and our finances had tanked. And I think there just wasn't this appreciation of you cannot ask for anything from these guys. They are incredibly stressed. I mean, we're seeing it. We need this. We've got all these providers. We need a couple FTEs. We need to get nursing scores. Were really not good on the class survey, and we need to be addressing that. And I just remember that it was such a strong no from every one of them. We all just kind of sat there. We couldn't say anything, but we should not. That was the wrong time. But did it stop us? Only momentarily. So now we have a couple of nurse informaticists, and we're trying to figure it out. We're trying to bring them into under us. We don't want siloed. That's timing again. That's my timing again. So we don't always get it right. So you can't be afraid to fail. My whole life, I see, you have to look at failure as an opportunity. And I've, counseled many medical students on this, who I didn't get into emergency medicine, what am I going to do? I said, well, if great people are made who jump over the wall after they hit the wall. I said, so this is your opportunity. So, but I mean, you really have to, I hookah, I never give up.
I have to say, your win-lose resonates with me. That's that whole thing where sometimes I get too passionate, and sometimes I actually look at it as I'm right. And that's the win-lose. In fact, I am living that a little bit right now in wearing a different hat. And I have to step back and be like, what am I trying to achieve? It's for the greater good. And also I have to check my own emotions and say, I'll give my opinion, and if they go in a different direction, what's the common ground we can reach? But I think that's a common one. So we love surveying. We are the Arch Collaborative, we survey. But I think there are and so we always recommend, if you've heard, like, hey, if you're going to do something, like, we'll do a pre-post survey, because if you want to scale it, especially in this day and age, like, how can you show the value? But I think there are probably other ways, and so the question is, how have you managed to demonstrate the value ROI of your endeavors at your organization? I will tell you one anecdote from Metro Health, and I think it's in a case study, I can't remember, is his physician informaticist, whenever there's a dollar ROI, like he always look for the dollar ROI and call it out, and that's also back to you have to share your achievements, but I think there are other creative ways. So any thoughts on how have you managed to demonstrate the value ROI of your endeavors?
Yeah, so I think that is, in some projects, that is much easier than others. We all, I think, struggle with quantifying the soft thing and trying to measure those things. I think having it be part of your culture, that you have OKRs, KPIs, that it is how we plan the project has been a transformational thing for us. So I think having that expectation that we are going to show the successes or the failures of this project, and we're going to measure that, is the discipline that we need to bring to it.
I have to say, sometimes demonstrating the value of a nursing informatics team or a physician informatics team is harder than one would think.
It's very
It
difficult.
really is.
Yeah.
Yeah, I don't know what your all's experience is, but the signal data doesn't move easily, right? I mean, we can work really hard to use it to drive ourselves, but you've got to come up with other ways to measure that. And surveying folks to death is not always a strategy for that. So I think we've got to get really creative and think about how in a particular context. But it takes, I think, a commitment to think about that before you execute, not in the rearview mirror. So.
Yeah, I think we face a lot of challenges at our organization. We're a really small rural hospital, a private or independent organization, trying to remain independent, and we're on multiple EHRs. We have a lot of challenges. Data aggregation can be challenging because of that, but I think some of our biggest successes over the last year and a half since we've really collaborated with the Arch Collaborative is, I was thinking this morning of all the things that we've implemented in the last year and a half since we started. And to me, that is a huge success. For such a small organization who, every organization, I think, challenges with budget. And I was talking to Dr. Fraze this morning, who's not part of my organization, but another small hospital, and really resonated with me that the challenges of advocating for informatics in general can be challenging, but when you're in a small hospital where finances and the ROI of an informatics team in such a small organization can really be challenging, and to look at everything that we have accomplished in the last year and a half with the buy-in, and that we're continuing to adopt more and more things is a huge win for us.
Yeah, so ROI is tough when you're talking about informatics, I think, because so much of it is what I consider soft money. And I know that our CFO, if I can say, he'll look at things very concretely as a budget line, okay, if we do this, this costs less, so we'll save this. Well, so when I go and say, have you read the data that, if you have to replace a physician, they're estimating that cost to be $500,000, or depending on what study you're reading. And they're like, well, there's no line in my budget that says replace physician, $500,000. So, it doesn't get their attention in the same way. So I think that's really, really challenging. So, I'm still struggling with that, to be honest with you, because so much of what we do is that way. But I will tell you, kind of going back to, I think Mark said a couple questions ago about, not promoting what we do. So I struggle with that because I want to be noticed, but I don't want to call the attention too much, because I think if you can get them to notice what you're doing, that's really the good thing. And I will tell you that my team has been noticed, and I've been told about it. So when we did the last wave of our rollout of Epic, it was in New York, and 6 months before the go-live date, I said to 10 of the docs, I said, clear your schedules, you're coming with me for 5 days. We're camping out in New York. We're going to do at-the-elbow support. We need to build relationships with these New York hospitals. They need to know us. You guys know it. And it was probably one of the best decisions I've ever made. Because I even had people come up and say, our docs like to act out, but I think they're behaving better because you're here. And I'm like, oh, okay. Well, maybe I should have your docs come over to UVM. So see if it works both ways. But anyway, so that kind of stuff actually is noticed. And I had a leader in the medical group say, who are these physician informaticists? I know that when they're attached to projects, things seem to get done more quickly, and they seem to be right. And so how many of those do you think we need? And I'm like, we need one in every specialty. So anyway, that's what I think.
So I think this is a related question, but I'm going to ask you if you have additional, is how do you justify your team, especially in this day and age? And one of my tricks is, I love easy things, is that every time I've done a physician informaticist team or something similar, is I say to them, keep a log of what you've done this year. It doesn't have to be hourly, but what did you do and what did it achieve? Because at the end of the year, we're going to be asked to show what we did, and you can't remember. And it is unbelievably how, and a simple log, and then when they meet with me on a monthly basis, I expect them to hand in the log, and that way I know what they're working on, and we don't have to spend our time talking about it, and it's also an easy way for them to update it. It's kind of really cheap and easy, but it has served us well. So any other thoughts?
We
on-
just, our informatics physicians, we call IT officers, but just moved to trying to quantify that. And this is a really handy, practical sort of thing. So I'm using Forms in Teams, and it's a survey. It's the same link. I ask them to fill it out. So like, who did you see this week? How many hours did you spend doing this? Which meetings were involved in? It's the same thing. Every Friday, I email that link out to everyone. And so that summates that in a spreadsheet for me. It's the same form. It's one huge Excel spreadsheet that has the dates and things.
He's
So-
higher tech than I am.
So practically, I think that's because getting folks to send you an email, so organizing that and try to quantify that. But I have now to help all those docs who don't like doing any of that to understand how important it is that we can quantify some of that. So that is leadership development, it's the why, it's all of the soft skills that we've been speaking of.
So our informatics team is fairly new within the last few years, and it continues to grow. We just got to provider informaticists part of our team, and we've really been focusing on outlining our roadmap and our strategy and making sure that the things that we are working on, all of those smaller things, are really in alignment with what our informatics strategy is, so that when it comes to the end of the year and we're looking at our deliverables, we know that our initiatives led to those action items. And I think, our CIO and IT leadership, and we all collaborate frequently and really look at trying to set out some goals quarterly and make sure that our action items are moving us in that direction. That's
So
really
I have
helpful.
a specific question for you. You said, which I loved, and I heard someone start to clap, that when there's a physician informaticist attached, the project goes better in all kinds of ways. How do you quantify that, and how do you share that?
That's, I think, one of the softer things. That's tough. But I will tell you that one of the things we've started doing is, because all my physician informaticists are builders, we've started, keeping track in ServiceNow everything that they're doing, so that we can actually show, some real work and projects and build that's been completed. So, that's one way to do it. I like your idea of keeping track, and, Mark says, about writing things down. We could do that better, and I think we should start doing that. Because it just reminded me that when I was division chief in the ED, I had to do that. And, I would have to meet with the chair, and I'd have to go over, what did you do? Because, honestly, at the time, we're our own department now, but we're under surgery, they don't understand us. Even though in the biggest division, they don't understand us. So, I think that's really good. And there is something, if you're builders, you can keep track of that. And we're heading towards hard money here. And I will say, if anybody wants to talk to me about starting or getting your physician builder program going, I'd love to talk to you about that. Because,
How do I get buy-in for that?
well, see, it's relationships. It's relationships. And timing and persistence.
And what was your fourth thing? You have four, you told
I
me.
do, data.
Oh, data, okay.
So,
Really?
okay, there's going
I
to be a
learned
test,
something.
and she may pass.
Yeah.
But anyway, they've totally disrupted me.
Oh,
But
I'm sorry.
anyway, if anybody wants to talk, but I'll recover. If anyone wants to talk to me, because it was a struggle, and I can tell you that the relationships were the key, because the analysts did not trust the physicians. And until I said, you have to spend this many hours, I've made a place for you to come and sit where the analysts work. Now it's harder, right? Because they're not there. But and it was that, and you know what? It's gone from, we don't trust them, to, do you think your docs can build this? Can they do this? We have, no. So it is possible. It's difficult, but it's possible.
You said something that reminded me. I also think there's huge value in whether your organization asks for it or whether you do it on your own, an annual report. So even though, like Cottage Health, I think, did it weekly, and we talked about everyone keeping track, is at the end of the year saying, my team or this team accomplished this. Because if that justifies, remember you got buy-in before, but that will also set the stage of, remember we talked, you said trust, and that I'm a person of my word, and hey, last time he or she did this, they did that.
We are data people, but I think we have to be critical. I'm just listening to how good the science is or isn't in what we've been saying. We've been using data to kind of prove our point. I think we got to be honest when we look at the data and say, wow, this team is not delivering what it should be. Maybe we can make these changes. So I think that honesty as we look at what we are delivering, what we aren't, and what we might need to modify, will again add to long-term value. But
And trust.
just want to make sure, and trust, but
That's a
just
really
want to make
good-
sure we're diligent scientists as we approach that.
That's a good point.
Yeah.
So we will open it up. I want one last question, which is a little hard. So not only we need buy-in from the top, sometimes we have buy-in from the top, or you already started with it, serendipity, that's part of this. But sometimes we don't have buy-in from the rank and file, and I hear this a lot surrounding ongoing training and support, that there are organizations that offer it and they can't get buy-in. So any thoughts on how do you carry the momentum downward as well?
Sometimes I'll sign emails with everyone on the executive teams as signatures with it. But I do think as you get this executive leadership, which trickles down to department leadership, and understanding the why behind what you're doing. And then as you're having successes and that being more apparent, then you get more buy-in from people.
Was at a presentation, I think, yesterday that one of the groups here said that they use signal data, they use data to figure out where to go. But once they arrive there, they really are committed to seeing people, we see you. And so I think being seen does an enormous amount to build credibility and willingness to follow someone where you're not necessarily excited to go. So I would say that that's an important principle as well.
And I agree totally with Mark. When you ask providers and nurses what they want, I want you to come to me. So they want you to come to them. And I think that is so powerful. Labor intensive, but powerful. So I think that's how you get the rank and file. You come to them.
And
Don't expect them to
advertising.
come to you. The other thing that kind of had popped into my head when we were talking about this was partnership. So I feel like so often I hear at IT meetings, this isn't IT's responsibility, this is operations. And I bet you, I don't go to the operations meetings, well, I do some of them, but
That's ops.
and when I do, they go, oh, that's IT. What are they going to do to fix that? And so, you know what? And I've been trying to, and every time I hear this at the IT meeting, I said, I don't look at it as is it mine or is it yours? I look at it, it's ours. And how can we form a better partnership? And if someone says, really, we need them to do it, I said, and I approach someone and say, would you partner with me and so we can work on this together? Because again, that's fighting my win-lose thing that I have to fight. But it's just something I've noticed, and I hear it. And I'll ask Dawn, does this happen at operations meetings? Are you saying this is IT's? Yeah, okay. So Dawn's one of our VPs in the medical group. But anyway, that's what I think.
One of the things that we've learned in the Arch Collaborative, and you've probably heard, is when you have successes, you have to market that. So that's also another way that you get buy-in. So we have about 8 minutes left, so I thought we would open it up, and we have some mics on the floor to pose questions, share your thoughts. Have you solved this all? Do you have any particular questions for the panel?
Fire as far as I'm trying to act like my son. Fire as far as a group panel that you guys put together. Fantastic, Dr. Maneker. I agree, showing the value is really hard. And a comment and then a question. Dr. Keller, that thing about not being self-promoting is really hard for us. And so we do struggle with that. And one of the things that we tend to be support and we make other people be successful. And sometimes framing that question of what we accomplished as in showcasing how that group used medical informatics to be successful to mentor the next group to use medical informatics takes the spotlight off me feeling like I'm showcasing my stuff. The question I have for Dr. Guy
That's a really
is,
good point, thank you.
It is.
Dr. Guy is, I left an organization and forgot to bring my form with me. Now I can't get back to it about how we were recording stuff. I'd love to see what you have. Is there a way you would share with
Sure,
us
absolutely.
what
It's,
that form is?
It's just 6 questions, really down and dirty, and it's, like I said, it's the team's form, and it's easy peasy.
Yeah, the 6
Glad to
question
do
is
it.
what I
Yep,
want.
we'll do that.
At some point. Thanks.
Yep.
Thank you. Anyone else? Come on. Nothing? We've covered it all?
Hi,
Oh.
I'm Brian Patty from Medics. One of the things that I found, I've been doing CMIO work for 25 years or so. Telling stories really helps. There's only so much data that can sway people, but if you've got, telling stories and saving quotes. I have my team save quotes all the time. And you ask that person, can I use your name in this quote, or can I do this anonymously and just say this came from one of our orthopedic surgeons to say I'm now saving an hour a day because of this personalization lab I did. I've gained that time back, already this week, and now it's just adding. So saving some of the quotes of some of the people that you've impacted, I think helps as much as any data. And so I encourage people to really to tell those stories in addition to showing the data and other ways of showing value.
So, thanks, Brian. I think that's a really good point. I think when we said marketing, I think that's under that. Like people's quotes of how much value, and when someone says, oh, I can't get my people to participate in some of the services we're offering. When someone says this was great, that's the message. And I want to reiterate storytelling. And so anyone who knows me knows I've been doing this kind of like Brian, like I have a lot of birthdays, a long time. And I often will say, so, like the classic thing we say in informatics of, it's not what you want, it's what you're trying to achieve. And then I tell a story that was true. I'm like, so let me tell you a story about it. Because I think the principles sometimes are hard to wrap your head around. So thanks for calling that out. I think when we're trying to get buy-in, the story helps.
Good morning. Thanks for the presentation. I'm Aldo from the VA. We have 138 medical centers and healthcare systems, each of which has an informatics footprint. And we're advocating through policy that they each have a senior leader dedicated to informatics. I see four clinicians, four clinical informatics leaders. Can you share with us if a group like ours with 138 medical centers and only 30% of those have clinical leaders of informatics, what attributes would you say to the non-clinician as informatics leader they should possess to be as effective as a clinical leader of informatics?
Oh, yeah. So you know what? It's not technical skill. It's people skill. That's the number one thing. I mean, a lot of times when people are putting together these programs, they think, okay, who knows SQL programming? And honestly, when you take the board, you have to know SQL programming. I mean, I had to teach myself these basic commands, And so, but it's not that. It's people skills. Because the problems that we face are complex and don't have easy solutions, and they can't be solved by an individual. So that's the bottom line for me.
I would say for non-clinicians, confidence is really, really important. I think many clinicians will blow smoke, and if you're a non-clinician, that can be overwhelming. So I would say that stick to your guns sort of personality is also important. So the gentleness and relationship, emotional IQ, relational IQ is really important. But you're going to have find folks that don't wilt, right? So
They can hookah.
So I love storytelling. I always tell this story when I'm building physician informatics teams. They always say, oh, so-and-so, he's really techie. And every time in the old days when I had an office and people came into it, because we all went to work, Every time I was recruiting for physician informaticists, I'm not kidding you, would have someone show up in my office and say, I write SQL code. And I'd write, great, I understand what SQL code can be used for. I know it from the boards. But that's not what we're really looking for. And so I think that people skills is for everything. Oh, thank you so much, Bob. I think we have time for one last question. And if not, I'm going to thank our panelists for joining us and sharing their honesty and openness. And thank you all for coming to the summit.
Thank you, everyone. Thank you, panelists. That was great. We now have our networking time. Well, we have a transition first, but we have our networking happening soon. They're topic-based, and these are the rooms. We're going to go in 30-minute waves, essentially, and we're asking that people essentially stay in the room that they decide for 30 minutes so we don't interrupt conversations kind of midway through in another room. So these are the rooms, these are the topics. Please pick a topic that you would like to go to and discuss. There isn't any content being shared. It's really an opportunity for you to ask questions to each other about these various topics. And remember the sign-up sheets. If you would like to continue conversations around these topics, feel free to sign up and we'll help coordinate some future calls.